Total Health Chiropractic, our expert in back and neck pain, is celebrating 17 years of service, treatments, and care. Today we have Dr. Christopher Miller and one of his patients, Kathy Adams, in studio with us. Welcome to 8 West.
Thank you.
And congratulations are in order. You know, we've kind of been with you. You've been talking on our show about feeling better, avoiding pain for a long time, and I can't believe it's 17 years.
I know, I'm surprised with it too, but you know, looking back over the years, I'm just really excited about all the relationships we've been able to create with so many patients and their family as well, and the lives we've been able to change. And you know, just from the beginning, I was always committed, just because of some of the health issues I went through and the way I was, my case was handled by the medical community. You know, I was just determined to always take on the toughest, most challenging cases, and really being committed to thinking creatively for solutions for these people so that they can really get those pains and the health problems that they have actually fixed.
And so it's great. I know we're going to hear from Kathy in just a second. I feel like we've heard from dozens of people that just one after the other talk about how you've been able to change their life and get them moving again, which is so important. But I want to talk about what you do that's different, that helps people get there, and that's the DRX 9000. And maybe how the DRX is different from other types of spinal decompression that's out there.
Sure. So DRX 9000 is a medical device that's used to heal and repair and regenerate injured discs in the spine. And there's been great success with it, and a couple reasons why it's so unique and frankly works a lot better than a lot of these knockoff tables that are out there is that to start, it uses what's called a servo motor to use to pull the patient. And a servo motor is a specific type of motor that can adjust and change itself 1,000 times a second. So it can interact with a patient during the course of the treatment. And then on top of that, computers are controlling that servo motor using what's called a logarithmic curve. And that ensures that the patient is getting the right treatment at that moment in their care to actually correct those disc problems. There's only one actual study, Rachel, that was done where they inserted a cannula into the intervertebral disc during the treatment that showed that it reduced discal pressure. And during that study, they used this logarithmic curve that the DRX 9000 uses. So it's a very effective type of treatment, you know, to help heal these injured discs and get people, you know, functioning once again.
I'm glad we're seeing this visual because patients talk about how relaxing it is, laying on the table and just kind of sitting there, allowing the work to be done. I know a lot of people have the misconception that going to see a chiropractor is a painful experience, when actually, I know a lot of patients say it's a positive one because not only are they feeling better, but they're avoiding surgery, they're avoiding injections, they're avoiding drugs, and it's a more natural solution.
Yeah. Well, a lot of patients that have come to us have been to chiropractors before, and you know, they share those same feelings with me. And you know, it's just interesting. A lot of offices don't really do any type of exam or x-rays or imaging. They just start treating the patient, and it's very important for us and our patients that we know what's wrong and diagnose that correctly. And you know, people think about chiropractic offices or visits, they think about snapping and cracking the spine and twisted like a pretzel. And you know, what I found in my experience is that technique is not usually very helpful to the patient when they have these degenerative conditions of the spine. It's just too aggressive. So, you know, we do much gentler treatments here, and you know, it's very effective, and patients are able to come in feeling relaxed, not stressed out, you know, being nervous that they're going to get, you know, snapped apart.
Sure, and Kathy can attest to that. And Kathy, what type of pain were you experiencing before you got the treatment?
I was in pretty severe pain. I avoided going to bed at night because I knew getting up in the morning was going to be excruciatingly painful. And I oftentimes would scream out in pain trying to get out of bed and hold on to the wall to get to the bathroom in the morning. You know, it was just, I was in extreme pain.
Yeah, back pain, severe back pain. And you tried some other treatments before actually getting help from Dr. Miller. Can you talk about that?
Yes, I had been going to a chiropractor near where I live, and as Dr. Miller said, he was just doing the ordinary adjustments, and it really wasn't getting to my issue. I had 2 herniated discs and a ruptured disc in my back, and no matter how much adjusting they would have done, it wouldn't have, you know, gotten my disc back in shape. And I went to my family doctor as well, and he did the medical route, trying to give me pain meds to help with the pain, and they just made me very, very ill. I couldn't handle the pain meds. And a friend of mine recommended Dr. Miller to me, and so I called and got a consultation with him, and the rest is history.
Sure. Well, tell us about the DRX 9000 and your experience with that particular machine, because that really is what makes Dr. Miller's solutions.
It's pretty amazing. I was on it, what, for 6 weeks, I believe, four days a week for 6 weeks. And of course, I was real nervous at first because I was in so much pain. I wasn't sure it was really going to do what it said it would do, because I had my doubts. Nothing else had been working so far. And the first few times you're on it, yeah, you're really sore when you get off. But that doesn't last long. And as you progress through the treatments, it gets easier and easier, and you feel better and better. And it worked. I mean, I'm in so much better condition than I was when I started.
Describe your life now.
Oh, it's, I would say 95% back to normal.
Wow.
I still have to do my exercises, my daily stretches, and eat nutritionally. And,
that's such good news.
You know, yeah, and get adjustments here and there. But my life is completely flipped back around for the better.
And that's so good to hear, Kathy.
Yes.
Back to living, and Dr. Miller, in hearing this, you know, the fact that a lot of people do take medications, you know, to kind of face that pain. I love that you offer solutions that give people an end to the pain, because that's what we should be striving and working toward, not just something that's covering it up. And so if anyone is seeing this or knows somebody that might be helped by it, what should they do? And you are offering an incentive for people that are new patients as well.
We are. You know, we have a great 17-year anniversary special, so if they want to call our office today and schedule a consultation with me, and usually we'll move ahead with a physical examination of their spine, they can do that for $17, and then as an extra special bonus, the first 3 callers, if we need to do x-rays, we'll take $17 off each set of x-rays we need to do.
Yeah, that is great, and a great way to kind of pull people into your celebration of 17 years and all the lives you've been able to touch. And it's not just Kathy, it's Kathy's family that benefits from her good health. And so thank you so much for coming on and telling us about this.
Yeah, my pleasure.
We're so glad to hear you're feeling better, Kathy.
Thank you. Thank you very much.
So
Appreciate
important. And don't go away. We'll be right back with more 8 West.